Tonsils are collections of lymphoid tissue facing into the aerodigestive tract. The set of lymphatic tissue known as Waldeye's tonsillar ring includes the adenoid tonsil, 2 tubal tonsils, 2 palatine tonsils, and the lingual tonsil. When used unqualified, the term most commonly refers specifically to the palatine tonsils, which are masses of lymphatic material situated at either side at the back of the human throat. The palatine tonsils and the nasopharyngeal tonsil are lymphoepithelial tissues located near the oropharynx and nasopharynx. Structure. Tonsils in humans include, from anterior, superior, posterior, and inferior. Development tonsils tend to reach their largest size near puberty, and they gradually undergo atrophy thereafter. However, they are largest relative to the diameter of the throat in young children. Function. These immunocompetent tissues are the immune system's first line of defense against ingested or inhaled foreign pathogens. Tonsils have on their surface specialized antigen capture cells called M cells that allow for the uptake of antigens produced by pathogens. These M cells then alert the underlying B cells and T cells in the tonsil that a pathogen is present and an immune response is stimulated. B cells are activated and proliferate in areas called germinal centers in the tonsil. These germinal centers are places where B memory cells are created and secretory antibody is produced. Recent studies have provided evidence that the tonsils produce T lymphocytes, also known as T cells, in a manner similar to, but different from, the way the thymus does. Clinical significance. Tonsils can become enlarged or inflamed and may require surgical removal. This may be indicated if they obstruct the airway or interfere with swallowing, or in patients with frequent recurrent tonsillitis. However, different mechanisms of pathogenesis for these two subtypes of tonsillar hypertrophy have been described, and may have different responses to identical therapeutic efforts. In older patients, asymmetric tonsils may be an indicator of virally infected tonsils, or tumors such as lymphoma or squamous cell carcinoma. Tonsillitis is a disorder in which the tonsils are inflamed. The most common way to treat it is with anti-inflammatory drugs such as ibuprofen, or if bacterial in origin, antibiotics, e.g., amoxicillin and azithromycin. Often severe or recurrent tonsillitis is treated by tonsillectomy. A tonsillolith is material that accumulates on the tonsil. They can range up to the size of a peppercorn and are white, cream in color. The main substance is mostly calcium, but they have a strong unpleasant odor because of hydrogen sulfide and methyl mercaptan and other chemicals. Tonsil enlargement can affect speech, making it hypernasal and giving it the sound of velopharyngeal incompetence. Tonsil size may have a more significant impact on upper airway obstruction for obese children than for those of average weight. Additional images. Illustration of frontal view of tonsils.